This is the Global Podcast Network, where executives and professionals connect, share, and inspire. Stay tuned for the conversations that drive success.
Bespoke Physical Therapy and Wellness joining us again. Move better, feel stronger, live well. Words of wisdom from our PT and owner, Lou Campasano, joining us live today from Greenville, South Carolina. How are you?
I'm doing well, Jill. How about yourself?
I'm doing all right. A few injuries like the back last week, which is getting better, by the way. You did offer me some techniques on the upper back with the wall, which I had to use a regular ball, but my back's feeling a little better. So thank you for that.
Good,
And we're
good.
excited you're back today. We're going to talk more about, what you're doing, of course. And for those that may not know, just tell us a little bit about your company and all the things that you can help someone out there listening to.
Yeah, so we are a physical therapy company. We specialize in mixed martial artists, youth athletics, and active adults primarily. We treat all kinds of injuries, throughout the body. Um, we specialize also in injury prevention,
Hmm.
mo functional mobility. When you have young athletes who are developing, we really work on getting them to balance out their joints, balance out their body so that they can improve their longevity in their sport, improve their ability to participate consistently. And we work on, strengthening and movement patterns.
Beautiful. And for today, what did you kind of want to highlight for us? I know we got a lot to
Well,
talk about. There's always something
um,
new.
We have a lot of people that come in here because I am based out of the Greenville UFC
Mm.
gym. A lot of contact sports, wrestlers, have football players coming in here and working out. We get a lot of concussions and even people who are your daily drivers, car accidents, stuff like that. So I want to talk a little bit today about concussion, what it is, what to look for, what to do about it, and how we treat it as physical therapists, athletic trainers, and how we get people back to doing their daily activities, whether it be someone who goes to a desk job or somebody who is a high level athlete.
Oop, you're here to help everyone. And one quick thing before we start. I fell yesterday in my garage and I have like this swelling. If I can pull it up, I got shorts on, swelling of the knee.
Oh,
So it's
wow.
funny. I went to my son's football game last night and a PT looked at it. He's like, "Oh, that's bursitis." He's like, "You're going to need to get that drained." I'm like, "What?" Ha, ha. I'm like, "Oh my God, what other injury elements?" As we get older, I feel like we're more prone. I fell. So about age, right? Just we gotta be careful, right? Because we want to prepare our body for strength now. So when we get older, our body could handle things a little better, right?
Well, you know what? Before we go into the concussion, I will just say that the thing that I try to teach the young athletes, all my patients in general, is that we need to start now, no matter what your age. We really needed to start yesterday on working on our bodies and making sure that we do have the movement, that we do have the strength, because injuries occur, and people who are in better shape heal faster.
Yeah. Mm-hmm. You also pointed out, there's a whole lot of factors of the working out, the stretching, and the eating right. And there's a whole balance of things, mind, body, and soul, that I know that you believe in and you cater to. And with the sports rehab place and functional movement, there's a lot to do with youth prevention too. So, what else? Let's see. What are we going to talk about today?
Well, let's focus on concussion.
Yeah. Mm-hmm.
So, what is it? What is a concussion? People have different interpretations, and things have changed in the last 10 to 15 years as far as how we grade them and how we look at them and what we do. But ultimately, a concussion is a traumatic brain injury. It's a minor traumatic brain injury, but it could also be fairly severe. Um, you start out and a lot of people think, oh, well, I blacked out. Well, then you definitely have a concussion. If you hit your head and you black out, that's a concussion. Okay. You have to treat it as such. but it could be as mild as what, football players or, boxing and MMA players. Oh, I got my bell rung, any kind of dizziness, anything that kind of slows or impedes your mental thought is a minor concussion. And so, you can grade it from, nothing to, severe. They used to have grading from 1 to 3, but they've gone done away with that because the problems can manifest over time, and that's how we kind of treat them. Obviously, if there is any kind of trauma, we want to assess and look at what to do. See what the symptoms are. So, for instance, somebody comes in and they get hit in the head multiple times during a training session. Let's take Muay Thai, kickboxing, and they come in and they're like, well, I'm a little dizzy, I'm a little rattled. So we assess, we do a neurological assessment. We check to see, what happens when they move their head, what happens, is their balance still good? Are they seeing double vision? All these things we take into account and we monitor. Um, are they vomiting? Are they, depending on the severity, if they just come in and say, "Oh, I have a little headache," okay, we're gonna check that and come back the next day. Let's see how you're doing the next day. And that should go away fairly quickly. Sometimes it goes away within 15 minutes. Other days it could be something that lasts 24 to 48 hours. Other times we have something called post-concussive syndrome that can last weeks to months. So what we do is we just kind of look at the symptoms, and if the symptoms are severe, say they get knocked out, I would say you need to go see a doctor. Monitor the symptoms for the evening, but the next day you need to go see just to make sure that go get a CAT scan, go get an MRI, just to make sure that there's nothing that we're missing. If it's severe. If you're vomiting and the vomiting gets worse, definitely go to the ER. These are red flags, things that you have to look for after a head trauma. Maybe your balance is worsening or you have weakness. These are things. Go to the ER. Um, just a little headache, not terrible, but you want to monitor it. You don't want to get back into the ring, onto the football field, and start playing again if 15 minutes ago you were a little dizzy, you know. It's always better to you know, if there's any question, better to sit out and wait a day and then go back. So what do we do? Um,
Yeah.
we're looking at things like, are they dizzy? Are they, do they have sensitivity to light? Do they have blurred vision or double vision? These things are all symptoms that we have to look at and monitor. So each day they come back, or every couple days they come back, we take a look, we monitor the symptoms. Symptoms are getting better.
Yeah.
What do we do? We take them through easy movement patterns. And we test them. Do we provoke symptoms? I'm not going to take a football player and obviously allow him to go back and start hitting pads if he has dizziness with a 40 yard dash, you know. I'm gonna see what happens with walking. Let's see what happens with head movement. If these things provoke symptoms, and when I say symptoms, it doesn't have to be blurriness of vision or sensitivity to light. They may just say, hey, I'm a little bit dizzy or lightheaded when I move my head back and forth.
Yeah.
Okay. So what we'll do is we'll say, okay, well, if it took, you know, 10 seconds of moving your head back and forth to cause dizziness, well, then we're going to give that as an exercise. And we're going to say, okay, you know what? If it goes away within a minute, we're going to do that again. And
Yeah.
we're going to basically improve their neuroplasticity. We're going to their brain's ability to tolerate these movement patterns. So we're going to have them look at something like a steady object, and we're going to have them move their head back and forth. And if they can do that for a prolonged period of time, then we're going to make it a little bit more challenging. We're going to have them move their head and talk to me. Maybe give them some simple math tasks. Maybe we're going to do their balance and do some simple math. Maybe counting backwards by nines or something like that. Something to challenge
Yeah.
them cognitively
Okay.
as well as physically. Um, and once their symptoms start going away, then we start introducing them back to things that they do. Maybe it's somebody who just comes in and weight lifts. So we might start doing them, throw them on the bike and say, all right, let's increase your heart rate. Let's get you doing some cardio. Let's see how things go with that. See what kind of presentation they have with challenging their body.
Yeah.
And then if, doing it on a stationary bike is good, all right, now we're going to try doing it, walking or jogging where there's head movement and body movement and putting everything in combination.
Got it. Well, also,
Uh,
let me just ask one question. When, there is
yeah,
someone on the field, like for example, I'm just thinking football concussion because of my son.
okay,
There was a
yeah,
PI in the field last year who was looking at the eyes. What happens to the eyes? Is something we could see as regular people? Does they dilate or not dilate? Are you just familiar
sure.
with that? Just another sign of it. Yeah. Thanks.
Okay, so I'm glad you asked that. So let's say you're at home with your child and they fall or something like that. You don't have a professional on the sideline. If I cover my eyes, one eye, my eye is going to dilate my other eye.
Okay.
If I put a shadow over my one eye, they should open evenly. They should both open or close depending on the amount of light that goes in or out. Once you change that, there should be a change and it should be equal.
Okay.
So if that's probably what they were doing is they were checking to see, do the pupils dilate equally on both sides? And if not, that's a neurological sign. Hey,
Got
something's
it.
wrong.
Got it. All right. Thank you. I just wanted to interject at that.
Yeah,
That was on my mind. All right.
sure,
So what else should we be looking
sure.
for?
Neck pain, a lot of times there, obviously if you're getting into a car accident, um, what will happen is you've heard of whiplash, okay? But what happens is the head goes forward, it comes back. Well, your brain literally goes forward and backwards in your head, and that can cause an injury to your brain,
Wow.
a concussion. They call it a contra coup concussion because it goes in one
Okay.
direction and the other. And it's when it comes back that it really causes the big problem. And so, but same thing hitting your head on the ground, you get the same exact thing. But you have a lot of neck pain. So we need to work on that neck pain and that tightness to help with decipher are your headaches coming from your neck, from that
Mm-hmm.
neck pain, or is it coming from your brain? So we do a lot of manual therapy, we stretch them, dry needling, things like that to help reduce the spasm from the neck and help, us decipher are your symptoms headaches that are continuing? Is it a post-concussive syndrome?
Mm-hmm.
Or is it something that is just, m- musculoskeletal, like you're like, just neck tightness?
And what's dry needling again for those that may not be aware?
Yeah, so dry needling is something that we do. It's like you take acupuncture needles and we put that directly into the muscle, all right, eliciting a muscle contraction which will help endorphins come in. And then we leave that needle in there. We twist that up a little bit. We get the fascia involved, which is something that surrounds all our cells, but particularly our muscles and causes
Okay.
tightness. We tighten that up a little bit. When we pull that needle out, it helps the muscle relax.
Okay.
Cupping, you can do cupping, things like that that help release muscle fascia and tightness just to help mobility and ease pain. So once we get people off of the field, we assess them, we're going through our rehab, maybe it's time to go back to doing these activities and they continue to have symptoms at a certain point. What do we do? Um, we have to make sure that immediately they get rest and not just sleep, but neurological rest. So, you know, maybe they might go home and they want to try to read. Well, that might
Mm-hmm.
increase their symptoms if they have a concussion. Um, and so we want to make sure that, they're not doing too much
Yep.
cognitively in the beginning. We want to
Yep.
give them that neurological rest. Some of the other things to look for after a concussion would be too much sleep or not enough sleep. It's funny because it goes both ways.
I never
It's
knew
really
that.
the
Okay.
change It's really the change that happens that you have to look for. If they're sleeping, you know, a lot, if they go and sleep 10 hours with that every day and that's not a problem for them and they go and sleep 10 hours, well, then that's not much of a change. But if they start sleeping only 5 hours and they can't
Yeah.
stay asleep, well, something's going on. And vice versa. If they typically sleep 5 hours and now they're sleeping 10, well, something's going on. Their brain needs a rest and it's taking it. But again, let's get the doctor involved. I think the one thing is that, people want to always go, oh, it's not that big of a deal. It's just a little headache. It's just this. But, and yeah, I can treat the symptoms. I can help with getting you back to doing things. It takes time. It takes constant assessment and changing of plans. If you come into me and keep telling me, hey, I keep getting headaches when I go for a walk past a mile, well, then we
Yep.
need to build that up. We need to figure out what can we do to improve your response to that activity. But we also have to make sure that you're still seeing your doctor. Make sure that we're checking to make sure that there's nothing else going on, brain bleeds, stuff like that.
Now, what are the, just curious because, what are the other, the medical factor, right? When you're getting, do you get, excuse my language, is it an MRI, CAT scan? I get confused. And how often, like, if you do have a concussion, do you have to follow up for one of these as well with a regular doctor?
Well, it depends on what they find.
Okay.
If and that's per the doctor. Does he want a CAT scan? Does he want an MRI? Does he want to use some sort of um, something?
Yeah.
Depends on what they see.
Mm-hmm.
If there's not a lot of damage, a
Okay.
lot of times they'll do it. They'll make sure that there's no bleeds, there's nothing torn, stuff like that, and they'll go, okay, we'll just do it on symptoms. You
Yeah.
know. If the symptoms are getting better and they didn't see much and the symptoms are getting better, so then they think, okay, everything's, the swelling is going down. Whatever they saw in the MRI or CAT scan is getting better. So they're not going to order another one. If
Got it.
symptoms aren't getting better or worsen, they'll probably get another one.
Whew. Oh, thank goodness. Now, have you ever had a concussion just personally, just if you don't mind me
Yeah,
asking?
I've had multiple. Yeah, I actually,
Oh,
when I was about 12, 13, I had a bad head trauma with some internal bleeding.
okay.
I fell off a bike and the thank God I had a helmet on. It saved my life, but I had a seizure. I went to the doctor, they released me. The hospital called me, had me come back because they found that there was a bleed. And I was, monitored at the hospital for 24 hours. And at that time, I mean, this was back in the early 90s. They didn't really have me go through physical therapy. They didn't have an athletic trainer. They didn't, nobody really, they just, sent me home and said, hey, if things get worse, come back. You
Oh,
know,
oh my
it was
goodness.
just kind of time.
Yeah. So you speak from experience as well. What else
Yeah.
about concussion should we be aware of and how we handle them and the process of healing our body and, helping with the therapy to help stop?
Yeah. So I think that you have to be proactive. You can't just sit and wait for it to get better. Because you have to realize that just like muscles, if you let them sit, they get weaker.
Mm-hmm.
Your brain's ability to respond gets worse if you do nothing.
Yeah.
You know, if you stop reading and you stop challenging your brain mentally, your mental capacity goes down as you age if you don't do anything. And so, you always have to start doing things to challenge it. Whether that be some limited exercise, whether that be reading, and again, you have to base it on symptoms. If you're feeling pretty good and a couple days later you're like, oh well, I'm gonna read this book, I have some work I have to get done, and you start reading and you start getting headaches, know how long it took you before you got that headache. Hey, when did I start? How long did it take? Maybe you get really tired. You're
Yeah.
like, oh, I gotta take a nap. That's your brain recovering. And so you have to listen to your body. You can't push it and push through it. You have to go, okay, you know what? Take a nap. And then the next time you go at it, you
Yep.
should be able to do it a little bit longer, but you have to train it to do that. Whether you're just doing work at home or going into the office, um, maybe you're good with everything, but when you turn around quickly, all of a sudden you get
Oof.
symptoms. I had a young girl come to me. She had dove into a pool and hit her head. Months had gone by and she was still dizzy all the time.
Yeah.
And so what we did was we did something called vestibular rehabilitation.
Okay.
Vestibular system is your inner ear balance center,
Okay.
and it connects with your eyes. So when I had her move her head, her eyes weren't able to maintain focus. Her eyes would move all over the place. And
Mm-hmm.
so what we did was we started with what we call gaze stabilization. She, looked at something and she moved her head, and that made her extremely nauseous. And we just said, okay, if you could do that for 10 seconds,
Yeah.
wait a little while and see how long it takes for you to get better.
Yeah.
And she did it again later on. And as time went on, she was able to do it longer and it took less time for her to recover. And I worked with her for months. Um, but she fully recovered. Um, she was able to go back to doing, I think she was a lacrosse player. So she was able to go back to playing lacrosse later that year. She also actually wound up becoming an occupational therapist because of what she learned from me, which was really, really rewarding. Um, but she did really well. But I think that was probably one of the worst cases I've had because it was so long. She had a true post-concussive syndrome that just wouldn't get better. And she was seeing all kinds of doctors, and the doctors were like, well, you just have to wait it out.
Yeah.
And I happened to work with her sister, and her sister was like, what can she do? And I'm like, get her in here as soon as possible. And yeah, because she was like, she would roll over in bed and get nauseous and throw up.
Oh
You know,
my
she was
gosh.
spinning all the time. She would, turn and she would spin but yeah, she did really well. So you can literally, work it out. You make it better, even if the damage is healed, your symptoms can still persist. And so it's really important to get tested, especially for young athletes, people who want to do competitive things. They really need to test themselves before they go and put themselves in a position where their reactions are slower. I mean, lacrosse, for example. If those guys, and I worked with a college lacrosse team, if those
Yeah.
guys aren't on their game, they can get hit in the head real quick. And
Ah,
that could and the problem is that if they're not fully recovered and they get hit in the head again, well, that's doubly important. It's worse, they're at higher risk for getting worse damage, you know. You don't want to get multiple concussions in a period of time, especially when you haven't healed from the first one.
yeah, for sure.
And
All
so
right. And continue. We still have a few more minutes left.
yeah,
Want to make sure
I
we're
think
covering
that
everything
that's,
about.
probably the long-term consideration is that, people go back to doing things that they want to do because they're anxious and they want to get back into it and they're driven. But I think that, the take home here is make sure that you challenge yourself appropriately before you go back to doing something. Not whether it's a car accident, playing a sport, if you're just a person who has to chase kids around, I mean, moving your head up and down and moving, if you're getting dizzy, if you're not feeling as strong as you were before, well, then you have to work it out. And if you're not getting professional help, you should go seek some out. It's not going to go away on its own with time.
Yeah.
You have to have the proper way to do it and somebody assessing you because I wouldn't take care of myself with a concussion because I don't know objectively what other people are seeing.
Mm-hmm.
If I got hit in the head or if I got knocked out training, I would go see one of my colleagues and to assess me and report back to them based on my symptoms because I don't know if I'm doing what I think I'm doing. Sometimes we think we're doing something a certain way and other people see it differently.
True. All
So
right.
it's hard to self-assess in these situations, you
Oh.
know?
Well, it's
So
always good to go to somebody who is, obviously knowledgeable in this field, has experience with this. And I know Bespoke clearly does that. And so many people do, as you mentioned, come to you for injuries, injury prevention, rehab, and so much more. And I know you are passionate about your work as a physical therapist and helping so many. And normally, how long do you work with someone who has a concussion? Just average?
it depends. It really depends on the severity I mean, literally, I've worked with people for 3 days and sent them back to doing what they were doing. And like I said, that girl I worked with for 6 months, you
Wow.
know. So it really depends. And that's why they got rid of the grading system because the grading system, oh, well, this is a grade 2 concussion but symptoms continue to persist. And it's like, well, maybe it wasn't a grade 2 concussion, you know? So we kind of have to monitor them over time. And
Mm-hmm.
really, it's all symptom based. And, um, obviously, if they go back and get an MRI and there's damage, well, then, the doctors take care of that a different way. But the fact is that symptomology is the way that we see if they're getting better or not.
Yeah.
And and so it really depends. It really varies depending on how they get hit, how hard they get hit, and where they get hit, where the damage is.
Yeah.
The brain, depending on where in the brain the problem is, can make all the difference.
Beautiful. Well, thank you so much, Lou. How can we
Yeah.
reach out to you directly?
Well, you can email me at lucy@bespokeptw.com. You can give me a call, 864-920-0696. And you can check me out on my website, bespokeptw.com.
Perfect. Thank you so much for informing us and enlightening us. I shall stay. And I hope you enjoy the rest of your day. And
Yes,
good
ma'am.
luck with those out there needing your help. Stay cool.
All right. You
We'll
too.
talk soon. Thank you,
All
Lou.
right.
Enjoy the
Stay
rest of your.
injury free.
Trying my best. Thank you so much.
You're
Bye
welcome.
bye.
This is the Global Podcast Network, where executives and professionals connect, share, and inspire. Stay tuned for the conversations that drive success.